This is the audio lecture for Chapter 1, 21st Century Maternity Nursing. Maternity nursing encompasses care of childbearing women and their families through all stages of pregnancy and childbirth and the first 4 weeks after birth. Maternity nurses teach about pregnancy, the process of labor, birth, and recovery, and parenting skills. They provide continuity of care throughout the childbearing cycle. Although tremendous advances have taken place in the care of mothers and their infants during the past 150 years, serious problems exist in the United States related to the health and health care of mothers and infants. Lack of access to pre-pregnancy and pregnancy-related care for all women, and the lack of reproductive health services for adolescents are major concerns. Sexually transmitted infections, including AIDS and HIV, continue to affect reproduction adversely. This lecture will present a general overview of issues and trends related to the health and health care of women and infants. Healthy People 2020 provides objectives for improving the health of all Americans. It has 4 overreaching goals. These goals are attaining high quality, longer lives free of preventable diseases, disability, injury, and premature death; achieving health equality, eliminating disparities, and improving the health of all groups; creating social and physical environments that promote good health for all; and finally, promoting quality of life, healthy development, and healthy behaviors across all life stages. 33 of the Healthy 2020 People's Goals are related to maternal, infant, and child health. The United Nations Millennium Development Goals are 8 goals to be achieved by 2015 that respond to the main developmental challenges in the world. Of the 8 goals, 3 relate specifically to women and children. They are goal number 3, promote gender equality and empower women; goal number 4, reduce child mortality; and goal number 5, improve maternal health. Integrative healthcare combines complementary and alternative therapies in combination with conventional Western medicine and treatment. Some examples of alternative therapies include acupuncture, macrobiotics, herbal medicines, massage therapy, biofeedback, medication, yoga, and chelation therapy. This is an image of a nurse and patient during a guided imagery session, which is considered an alternative method. Problems with the United States healthcare delivery system. The United States healthcare delivery system is often fragmented and expensive and is inaccessible to many. Opportunities exist for nurses to alter nursing practice and improve the way care is delivered through managed care, integrative delivery systems, and redefined roles. Medical errors are a leading cause of death in the United States and result in as many as 98,000 deaths per year. So what are some ways we as nurses can aid in reducing medical errors? High cost of health care. Healthcare is one of the fastest growing sectors of the U.S. economy. Currently, 17.4% of the gross domestic product is spent on health care. Midwifery care has helped contain some health care costs. However, not all insurance carriers reimburse nurse practitioners or midwives as direct care providers, nor do they reimburse for all services provided by nurse midwives. This situation continues to be a problem in the United States. Limited access to care. Barriers to health care must be removed so pregnancy outcomes and care of children can be improved. The most significant barrier to health care is the inability to pay. The number of uninsured people in the United States in 2010 was 49.9 million. Lack of transportation and childcare are also other barriers. Also, there are fewer doctors to care for the uninsured or pregnant woman on Medicaid. And many physicians choose not to accept Medicaid, so this also hinders a woman's access to health care. Healthcare reform. The Affordable Care Act, which was recently instituted, provides that all Americans should have health care coverage. No matter what your political view is on this subject, as nurses, we should become more politically involved in the politics of medicine. Health literacy. Healthcare providers contribute to health literacy by using simple, common words, avoiding jargon, and assessing whether the patient understands the discussion. Speaking slowly and clearly and focusing on what is important increases understanding. As nurses, we need to assess our patients for understanding and reading comprehension. We cannot assume that everyone knows how to read. We also cannot just hand them paperwork and document that patient education was done without reviewing to see if the content was mastered by the patient. Trends in fertility and birth rate. Worldwide, approximately 800 women die each day of problems related to pregnancy or childbirth. The overall number of maternal deaths is small. Maternal mortality remains a significant problem because a high proportion of deaths are preventable, primarily through improving the access to prenatal care. The three leading causes of maternal mortality in the United States today are gestational hypertension, pulmonary embolism, and hemorrhage. Factors that are strongly related to maternal death include age, younger than 20 or older than 35, lack of prenatal care, low educational attainment, unmarried status, and non-Caucasian race. Maternal morbidity currently is not measured. We usually rely more on the maternal mortality rates. But maternal morbidity includes such conditions as acute renal failure, amniotic fluid embolism, CVA or stroke, eclampsia, which we'll talk about later, pulmonary embolism, liver failure, obstetric shock, respiratory failure, septicemia, and complications of anesthesia. Maternal morbidity results in a high-risk pregnancy, and we will discuss high-risk pregnancies later also. Obesity. Approximately 20% of women who give birth in the United States are obese. The two most frequently reported maternal medical risk factors are hypertension associated with pregnancy and diabetes, both of which are associated with obesity. Decreased fertility, congenital anomalies, miscarriage, and fetal death are also associated with obesity. Obesity in pregnancy is associated with the use of increased healthcare services and longer hospital stays. Regionalization of perinatal healthcare services. Basically, in a certain region, different hospitals provide different levels of care, such as in labor and delivery we have levels 1, 2, and 3, and typically your level 1 is your low risk pregnancies and your level 3 are your high risk pregnancies. So in the Bay Area, I think Bayfront Medical Center is a level 3, Tampa General is a level 3, and St. Joe's Women's. They are all level 3 hospitals, and they can handle the high-risk pregnant patient. Social media, we all know Facebook, LinkedIn, Instagram, Twitter. All of these are social media platforms, and basically with the technology these days, it allows people or nurses who have lack the same interest to communicate over the World Wide Web. Your book also cautions about the use of social media in healthcare, and I have found students while working in clinicals taking pictures of patient charts and patients and different wounds that they had to dress and posting them on one of these social medias, which is really an ethical no-no. Community-based care. A shift in settings from acute care institutions to ambulatory settings, including the home, has occurred. Even childbearing women at high risk are cared for on an outpatient basis or in the home. Technology previously available only in the hospital is now found in the home. This has affected the organizational structure of care, the skills required in providing such care, and the cost to consumers. Prenatal care. We place an emphasis on women receiving prenatal care in their first trimester of pregnancy. In 2006, 69% of all women received care in the first trimester. The benefits of receiving prenatal care in the first trimester is better dating of the pregnancy, earlier diagnosis of risk, and overall better pregnancy outcomes. Midwives and doulas. Women can choose between doctors or nurse midwives to deliver their babies. The nurse midwife specializes in low-risk pregnancies, whereas your obstetricians can practice with low to mid-risk pregnancies, and perinatologists, which are our high-risk specialists, deal with high-risk pregnancies. If a woman chooses to have a doula, basically a doula is a birth attendant, so she is there or he is there to help the mom with labor. So they do a lot of alternative things such as aromatherapy, massage, water pressure, things like that to help the mom with the labor. International concerns that your book mentions. Female genital mutilation or infibulation is the surgical closure of the labia majora, is also known as genital cutting and circumcision. Basically, part or all of the female external genitalia is removed for cultural or non-therapeutic reasons. And in America, we've seen a big influx of women with female genital mutilation. I know when I worked at Bayfront, we had a huge community of Africans who had lived in camps in Somalia or Sudan or somewhere in Africa, but they came over, they were brought over to the United States, and we all had to have specialized training on dealing with the pregnant patient who had had genital mutilation surgery or the procedure. And I know I took care of several of the African women, and also I had another woman who was of Arabic background who also had the female genital mutilation. So it was quite difficult to labor these patients because basically there was only a small hole where that urine and the menstrual bleeding every month could come out. So basically, at the time of delivery, the physician, we had to use almost an epidural for a cesarean, but they would cut open the perineum, the mom would deliver the baby, and then, as at the request of the mother, they all would ask the doctor to sew them back up. We had a lot of ethical issues. A lot of doctors really did not want to sew them back up. But what I found out was that if these women were not sewn back up, they were actually shunned from their communities. So a lot of them wanted to be sewn back up. Another major international concern that your book mentioned is human trafficking. Usually, a healthcare provider may come into contact with these women and can help them with healthcare services and help them escape from their situation. This is a picture of a father helping to deliver his baby, and you see this a lot with nurse midwives. We are very hands on. We like to get the families, the fathers, the significant others involved. And typically, once the head is delivered and the shoulders are out, we either let the mom, she can reach down and pull the rest of the baby out, or we have some dads who do like to participate, and we offer them the chance to actually deliver the remaining of the baby and then cut the cord. The future of nursing. In 2008, the Robert Wood Johnson Foundation and the Institute of Medicine initiated a 2-year process to meet the need to assess and transform the nursing profession. The committee developed 4 key messages. The first, nurses should practice to the full extent of their education and training. 2, nurses should achieve higher levels of education and training through an improved education system that promotes seamless academic progression. 3, nurses should be full partners with physicians and other healthcare professionals in redesigning healthcare in the United States. And 4, effective workforce planning and policy making require better data collection and an improved information infrastructure. Trends in nursing practice. Evidence-based practice. I know you guys hear this day in and day out, but evidence-based practice is providing care based on evidence gained through research and clinical trials. The Association of Women's Health, Obstetric and Neonatal Nurses, which is AWON, they offer evidence-based practice articles. They're a journal specifically for women's health and the neonatal nurses. The Cochrane Pregnancy and Childbirth Database oversees up-to-date systematic reviews of randomized controlled trials of healthcare and disseminates these reviews. The premise of the project is that these types of studies provide the most reliable evidence about the effects of care. The Joanna Briggs Institute provides another source for perinatal nurses to assess information to support evidence-based practice. Global perspective. As the world becomes smaller because of travel and communication technology, nurses and other healthcare providers are gaining a global perspective and participating in activities to improve the health and healthcare of people worldwide. Outcomes of care. This is the effectiveness of interventions and quality of care. They are receiving increased emphasis. Outcomes-oriented care measures effectiveness of care against benchmarks or standards. It is a measure of the value of nursing using quality indicators and answers the question, did the patient benefit or not from the care provided by the nurse? This photo is an example of global perspective. Here we have a nurse interviewing a young girl accompanied by her mother in a clinic in rural Kenya. And more these days you will see groups of Physicians Without Walls. You have certain religious organizations that do mission trips. It has been a lifelong dream of mine to go to underserved areas throughout the world and offer prenatal care. And one day I will get there. And another one of my big dreams was for an OB rotation, if I could take nursing students with me and we go and we just delve into OB in a different country. Would that be awesome? Nursing standards of practice in perinatal and women's health nursing have been described by several organizations, including the American Nurses Association, or ANA, which publishes standards for maternal child health nursing; AWHONN, which publishes standards of practice and education for perinatal nurses; ACNM, or the American College of Nurse Midwives, which publishes standards of practice for midwives; and the National Association of Neonatal Nurses, or NAN, which publishes standards of practice for neonatal nurses. Risk management. Risk management is an evolving process that identifies risk, establishes preventative practices, develops reporting mechanisms, and delineates procedures for managing lawsuits. Nurses should be familiar with concepts of risk management and their implications for nursing practice. Effective risk management minimizes the risk of injury to patients and the number of lawsuits against nurses, doctors, and hospitals. The Joint Commission reporting of sentinel events. The Joint Commission describes a sentinel event as an unexpected occurrence involving death or serious physical or psychological injury or the risk thereof. Serious injury specifically includes loss of limb or function. These events are called sentinel because they signal a need for an immediate investigation and response. Reportable sentinel events in perinatal nursing include any maternal death related to the process of birth, any perinatal death unrelated to a congenital condition and an infant having a birth weight greater than 2,500 grams, severe neonatal hyperbilirubinemia, and infant discharge to the wrong family. Failure to rescue. That is the failure to recognize or act on early signs of distress. This was introduced in the 1990s, and many hospitals have what we call rapid response teams, and these are people, typically doctors, ICU nurses. If we see things starting to go sour, or if we see patients starting to spiral down that drain, we can signal the rapid response team, and they can come look at the patient, maybe give medications, offer to move them to a higher level of care. Quality and Safety Education for Nurses, or QSIN. This is an effort to provide nurses with the competencies to improve the quality and safety of the systems of healthcare in which they practice. Promoting a culture of safety, effective communication, and team building are important in providing safe care during the labor and delivery process. Teamwork and communication. The Situation Background Assessment Recommendation, or SBAR technique, gives a specific framework for communication among healthcare providers. SBAR is an easy-to-remember, useful, concrete mechanism for communicating important information that requires a clinician's immediate attention. Failure to communicate is one of the major reasons for errors in healthcare. The SBAR technique has the potential to serve as a means to reduce medical errors. Team STEPS was developed as a teamwork system for health professionals to provide higher quality, safer patient care. It provides an evidence base to improve communication and teamwork skills. Ethical issues that we currently see in perinatal nursing when it comes to reproductive technology. There's induced ovulation, in vitro fertilization, multifetal pregnancy reduction, menopausal women, a woman who is HIV positive becoming pregnant, rights of the embryo, and cloning. Innovations in allocation of resources, intrauterine fetal surgery, fetoscopy, therapeutic insemination, genetic engineering, stem cell research, surgery for infertility, surrogate childbearing, and treatment of very low birth weight babies. All of these would be great topics for you guys to present for your debate project. Research in perinatal nursing. The ethical guidelines for nursing research. The researcher must protect the rights of human subjects. They must ensure that subjects are fully informed and aware of their rights. The researcher may be involved in determining whether the benefits of research outweigh the risks to the mother and the fetus. And they must follow the ANA ethical guidelines in the conduct, dissemination, and implementation of nursing research, which helps nurses ensure that research is conducted ethically. Okay, question 1. To assess a mother's risk of having a low birth weight infant, the most important factor for the nurse to consider is A. African American race, B. Cigarette smoking, C. Poor nutritional status, D. Limited maternal education. If you answered A, you are correct. For African American births, the incidence of low birth weight infants is twice that of Caucasian births. Race is a non-modifiable risk factor also. Option B is incorrect. Cigarette smoking is an important factor in potential infant mortality rates, but it is not the most important. In addition, smoking is a modifiable risk factor. Option C is incorrect also. Poor nutrition is an important factor in potential infant mortality rates, but it is not the most important. In addition, nutritional status is also a modifiable risk factor. Option D is incorrect. Maternal education is an important factor in potential infant mortality rates, but it is not the most important, and it is also a modifiable risk factor. This concludes the audio lecture for Chapter 1. Thank you.